Tomilan. So, of course, my dear sister taught me all the time. Great to be with you here, Your Excellency, the President of Botswana. I'm really honored to have you today and meet you for the first time. Your Excellency, the First Lady of Botswana, Mrs. Neo Masisi. Thank you very much for the generosity and the hospitality. But more than this, thank you for your dedication and leadership and the hard work, which never stopped even during Corona. When I met you in 2018, where we started our long-term partnership with Botswana, when I've seen you with all your grace and education and dedication and hard work and organization skills, I knew this program will be a great success in Botswana. I never doubted it. I never doubted, even during Corona, I knew that you're gonna continue. We had the Zoom calls, we have the calls, we have everything online, meetings, to make sure that every step in the program is seamless and never affected by the lockdown. And this is what exactly happened. So, of course, I would like also to acknowledge the presence of the ministers of health, education, and information and communication, which you set up the partnership and the introduction with them, so we can, as Merck Foundation, achieve our vision, which is already aligned with your vision and His Excellency vision, to make sure that the healthcare system in the public sector is accessible, equitable, and high quality, and everyone can have access to equitable and quality healthcare solutions in Botswana. So with 45 scholarships we provided for doctors in many critical and underserved specialties. I think this was a great achievement and milestone that we should celebrate today, along with the launch of our program and partnership. With the honor for you to be our ambassador, the Merck Foundation, more than a mother ambassador, to empower women, to break the stigma of infertility, to support girls' education, and also to transform patient care landscape in Botswana and the rest of Africa. Because as you know, the First Lady of Botswana is also a member of a great and big platform of other First Ladies of Africa, our sisters, and we all work together annually to work on a strategy, not only on Botswana or in each country, but also across the African continent, how to lead Africa to a better future, how to lead Africa to a healthier and more flourished future. So with these 45 scholarships, it's not the end. It's here, we are here to scale it up and even to double it, so it can actually be a greater milestone when we come next time to celebrate. Ladies and gentlemen, it's not only a healthcare system, but also educating Linda, education, girls' education, which is very close to your heart, because you always told me that girls' education is the only strategy for women empowerment. When a girl is educated, she's empowered, she's a stronger woman. And when she is a stronger woman, it's a stronger family, and a stronger community, and a stronger country. So let's be together and support all our girls to have this girls' education and to make the social and health and economic development the country deserves, with us as women also contributing to the social and economic development of the world. So therefore, we have today a few things we are going to do that you're gonna, I'm not going to burn it now, just wait, stay tuned for you to know that we're gonna support few girls that are very high performance but underprivileged, so they can continue their education for the next 5 years. which is we are going to also follow up on them and to see how successful they are, how they reach their goals, and make them as ambassadors for the rest, or champions for the rest of the girls in Botswana, so they encourage them that education is important, encourage their family to support them, encourage the community to look at girls' education in a different way. So we also had, of course, great initiative started by Her Excellency, and I remember we cycled together online during Corona. So your cycling tour to stop GBV, gender-based violence. This was very inspiring. I showed to all the people I know, because it's the first time for me that I cycle with one of my sisters, the First Lady of an African country, and Botswana specifically, so to raise awareness about GBV, but not only that, it's actually during Corona. So it was really amazing, and we celebrate Your Excellency birthday in that day also. It was really a great memory. So together also, we continued to support the women suffered gender-based violence through donation of sewing machines that we are going to see in a field visit today as well. And this was great addition because it makes them independent. It makes them contribute to society, have their own income, and be stronger, and of course, never accept to be violated. So, of course, next year we are going to do something for the infertile women, our women who lived with infertility, because as the ambassadorship of Merck Foundation More Than a Mother that Her Excellency have, we empower women who lives with infertility stigma. It's not necessary to be infertile, but as you know, infertility affects women and men equally, 50% scientifically. But men, most of the time, don't want to admit they are infertile. So they are always, the women is the cause. We want to advocate against this. We want to empower these women through information, access to information, education, and change of mindset, so they know that they are more than mothers. Every woman is more than a mother. Don't worry. Also, every man is more than a father. So don't worry, it's not a taboo, it's not a stigma, it's a very, very small condition like diabetes, like hypertension, can be prevented, can be managed, it's no pressure. So let us support each other. Wife and husbands, join hands, go to sit together, go to the journey of treatment together, and have a happy family. So this is our main goal of More Than a Mother. Of course, through the 45 scholarships, there are many scholarships that have been provided to provide fertility specialist training, embryology, and also reproductive and sexual care, 1-year diploma and 2-year master degree. And you will hear some of their testimonies today. So I'm not sure if I gathered everything because there are too many things we have done. This is only a small brief of our impact, but today it's very special for Merck Foundation because we are the first time in Botswana. We came all the way, I came all the way from Dubai, Professor Frank came all the way from Germany to be with you to launch for the first time our partnership, which is running already, but we want to launch it physically in Botswana for the first time. So thank you very much for having us. And we are very grateful, we are very happy with the follow-up, and we know these programs will be always success and from strength to strength with your dedication and support. Thank you very much.
His Excellency, the President of the Republic of Botswana, Dr. Mokgweetsi Masisi. Her Excellency, the First Lady of Botswana, Mrs. Neo Jane Masisi. Honorable Ministers, members of the Diplomatic Corps, distinguished partners and healthcare providers, Merck Foundation Alumni of Botswana, distinguished media partners, and Merck Foundation award winners. Ladies and gentlemen, I'm extremely pleased that we have two distinguished guests attending our meeting today. His Excellency, the President of the Republic of Botswana, and our long-term partner, Her Excellency Mrs. Neo Jane Masisi, the First Lady of the Republic of Botswana and Ambassador of Merck Foundation More Than a Mother. Today we will officially launch the different Merck Foundation programs in the country. And by this, we will underscore our commitment towards building healthcare and media capacity, patient care landscape, transformation, ending GBV, breaking infertility stigma, and supporting girls' education in Botswana. Our close partnership with the First Lady of Botswana began already in 2018, and over the years we have achieved many important milestones. I'm proud to share with you that Merck Foundation has since then provided 45 scholarships of 1-year online PG diploma and 2-year master's degrees for local doctors from Botswana. So we have trained doctors in underserved and critical medical specialties, such as oncology, diabetes, endocrinology, embryology, fertility, sexual and reproductive care, acute medicine, dermatology, obesity and weight management, respiratory care, and internal medicine. My colleague Dr. Rasha mentioned that figure before, 45 scholarships, but of course we have to put it in relation to the population of 2.7 million. So it's a very high number we already trained, given that in some of the bigger, much bigger neighboring countries of a population of 55 to 60 million, we only trained 150 to 180 doctors. So we achieved a lot already in Botswana. The objective of the scholarship programs is to contribute to advancing healthcare capacity with the aim to establish a strong performance and platform of skilled and specialist healthcare providers across the whole Republic. We strive to improve the overall health and well-being of people by building healthcare capacity across Africa, Asia, and other countries as well. So we are committed to transforming the patient care landscape through our scholarship programs, and it works. We strongly believe that empowering people will lead to a better future, and also we believe that good healthcare can transform the lives of individuals and families across developing countries. It will significantly contribute to economic and social development because healthcare is a major driver of economic growth and consequently of social progress and increasing the wealth of a country. We all know that the lack of financial means is not the only challenge in Africa, but the scarcity of trained healthcare personnel capable to tackle disease prevention, diagnosis, and management at all levels of the healthcare care system. This is the biggest challenge. The sweeping shortage of medical and healthcare manpower is a crucial limiting factor, not only in Botswana but around the world. As per the WHO 2017 report, unfortunately we do not have earlier figures or later figures, Africa had just 168 medical schools in the entire continent. Only 1 medical school in 24 countries and no medical school in 11 countries. Sub-Saharan Africa, with 24% of the world disease burden, has only 2.8 healthcare workers per 10,000 capita. This is compounded by the maldistribution of workforce among rural and urban areas and the public and the private sector. For example, before the start of the Merck Foundation programs in 2012, there was not a single oncologist, fertility specialist, or diabetologist in many countries. In countries well known, such as the Gambia, Liberia, Sierra Leone, Central African Republic, Guinea, Burundi, Niger, Chad, Ethiopia, Namibia, Myanmar, and Bangladesh. Furthermore, these countries have either no or very limited specialized doctors in many specialized critical fields. Therefore, till today, Merck Foundation has provided more than 1,810 scholarships for young doctors from 52 countries in 42 critical and underserved medical specialties. Many of them are becoming the first specialists in their respective countries. Dear partners and alumni, I'm very happy to meet you today to hear from all of you later on your success stories and experience gained from these training and these educational programs. I congratulate you all I know many of you have already graduated and the rest are now undergoing their scholarships successfully. We appreciate that you are taking your study seriously, as it will significantly contribute towards your own personal future career, but also towards the quality of your practice, hence will further continue to contribute to improved patient access to equitable and quality healthcare in Botswana, and it will help to improve the general healthcare landscape in the country. Today, we are also meeting and recognizing the winners of the Merck Foundation Media, Film and Song Awards from 2020 to 2024. Well done. Happy to meet you all. I'm very proud of you all that you did it. We at Merck Foundation believe strongly in the critical role that media and art plays to create a cultural shift and to address all social and health issues in our communities and to shed a lot of light to everybody that we have the ability to improve our lives further. So let us all work together to transform the patient care landscape and raise community awareness about sensitive and critical health and social issues in Botswana and across other African countries. I'm looking forward to meeting you all again in the near future to celebrate your success stories after the rest of you will have graduated later on this year. I'm also very happy to launch our Educating Linda program in close partnership with Botswana's First Lady to support girls' education through providing scholarships and bicycles for 40 schoolgirls to cover their transport and other educational expenses. So I tested one of the bicycles myself yesterday, and I tell you, they're really first-class bicycles. So that will help the girls to reach their potentials and achieve their dreams. And I'm sure this program will be a great success as well. Last but not least, I would like to thank again the Excellencies, the President and the First Lady of Botswana, for the great hospitalities we are enjoying during these visits and the continuous ongoing support, which is enormously important for our work here in the country. I would like to emphasize our commitment towards our long-term partnership with you. We are looking forward to scale up our efforts to provide more scholarships and more healthcare for more healthcare providers in Botswana. So, we are very proud to work closely with the First Lady of Botswana and the government to contribute towards the health and social development of this beautiful country. And I'm personally, I must say that, give me the chance to say a personal word, very happy that we have already achieved such a lot, and without the support of the First Lady and the President and of course also the ministries, we could never have achieved it. So thank you very much for all of that. Thank you.
May I now ask, ladies and gentlemen, that you join me as I invite Her Excellency, the First Lady of the Republic of Botswana, Meneo Jane Masisi, to come and receive her official recognition as Ambassador of Merck Foundation, More Than a Mother.
Filled with beauty, filled with pride, let every woman feel alive. You are greater than a nation, you are a woman.
You are a woman, God made you for a reason, so don't you ever give up on yourself.
Excellency, my very dear wife and First Lady, and now, more than a mother, Ambassador, Neo Jane Masisi. Minister of Health, Tikuroti, Minister of Labor and Home Affairs, Mokgweetsi, Assistant Minister of Education and Skills Development, Mokgweetsi, the Chairman of Merck Foundation Board of Trustees, Professor Frank Stangenberg, Haverkamp, Chief Executive Officer of Merck Foundation, Senator Dr. Kelej, the Khosi Wahumagadi who are here, the PSP, and all ambassadors, high commissioners, heads of international organizations, and other members of the diplomatic corps, all permanent secretaries and their deputies here, senior government officials, the performing artists, the Mafita Khosi and the little one, members of the Fourth Estate, the media, invited guests, especially her First Lady, the First Lady's guests, Merck Foundation beneficiaries from across the country. I greet you this morning. Good morning.
Good morning.
Nestled under Pillar 2, the human and social development of our Vision 2036 is a commitment of the state to guarantee access to health care services of the highest standard, attainable through advanced technologies and innovative delivery systems. A further reading under the same pillar captures issues of social inclusion and equality, as well as targeted initiatives that include better education for the youth and children's well-being. It is critical that we marshal structured initiatives in a systematic and holistic manner that considers various social determinants of health, which usually encompass non-medical factors, in order to enhance the prospects of realizing the goal of achieving full potential for health and well-being for all across their lifespan. Today, we stand on a threshold. As a nation, we have yearned for Botswana to live long and healthy lives, which on its own is a prerequisite for development. The total transformation of the patient care landscape is beginning to appear on the horizon, thanks to the capacity building programs provided by partners such as the Merck Foundation, as we heard from the chairman. True to the aim of improving health and well-being of people across the African continent through science and technology, the Merck Foundation is scaling new heights in the rollout of their cooperation framework and program. Today, we have a splendid opportunity to witness the unfolding of this transformative journey. Our medical personnel have benefited from 46, I'm told, scholarships provided by Merck Foundation, working in collaboration with the First Lady of the Republic of Botswana. It's a good number relative to the population, as was acknowledged. But you know, it's never enough. The study programs, which cover a wide range of disciplines in the medical field, including endocrinology, embryology, fertility, and sexual reproductive care, among others, will revolutionize our healthcare and add gravitas to the strong movement that aims to empower women living with the infertility stigma. And the last time I checked, the formation of a new individual involves usually the union of male and female, who are also human. In the obscured view of some, the shade of infertility casts on one side, which is the female. There are ceremonies. I'm happy to learn that Merck Foundation is also increasing opportunities for capacity development that specifically targets the girl child, which is often faced with more disadvantages than her male peers, including cases of dropout, and therefore more deserving of motivation and inspiration to be part of that graduation process. Through this initiative that fosters education of the girl child, we should be able to dispel the stereotypes that often compel young girls and women to be twice as good or as qualified for them to earn their rightful place in society or make it into the echelons of power and leadership. Twice. Eesh. Can I have a wife and a daughter? That's why I take this to heart so much. And like all of you, I'm also born of a mother. But unlike many of you, I don't know why you don't do what I do. I need not illustrate how under my government, women continue to distinguish themselves and break barriers with the assumption of high leadership positions. We're encouraged that in Botswana, women have set themselves apart and continue to step onto higher pedestal, which sums up their merit and worth as individuals and the values they stand for and promote. For the very first time in the history of our country, we now have the post of Minister of Finance led by a woman. The list of women appointed to leadership positions of higher responsibility include the Permanent Secretary to the President and her deputy, the Attorney General, the Auditor General, the Clerk of the National Assembly, the Commissioner of Police, whose last portfolio was Commissioner of Prisons, also is a woman. By 2023, we had 50% Permanent Secretary positions occupied by women. They have all demonstrated that when leadership matters, they bring the best in their credentials, grit, determination, and hold their own in terms of the qualification of character, uprightness, probity, and consequential hallmarks of being invariably astute. Our greatest wish is that our political landscape could also change so that young girls would have more role models for unquestionable commitment to public service, taking up roles in advocacy campaigns and community engagements, especially for the benefit of the marginalized and underserved communities. All the time being careful to remember, hard work and ambition makes a woman more than a woman. So le go baakanya go ditlhophong. La ga le baakanya tse ntlha e siameng. There are those ceremonies. It will be remiss of me not to echo the sentiments I expressed during the State of the Nation address on the 6th of November 2023. We must learn to change the equation when issues that affect women and children are at stake. We cannot afford to be bystanders or prefer idle talk. When there are grave issues surrounding gender-based violence, which recently has morphed into an obscene spate of senseless and merciless murder of innocent and defenseless women and children. The future of our country will not be best served by preoccupation with testosterone and the inglorious self-coronation by some who should be best advised to invest their emotions in love and care. Testosterone alone is not a problem. is actually good. But when it's combined with the evil intentions of violence, murder, then it should be arrested. I remember we had a lively debate in Cabinet when we were discussing the Constitutional Amendment Bill. And I was keenly observing the reactions of my different members of Cabinet as per the agenda to the question that had been put, which was one of what to do when somebody rapes an infant and a very old lady. You can guess, many of those who could associate with the victim by the gender wanted emasculation. Emasculation ke loka se khwa le rang badizo kanti tipana. Hola thwa ditoloki. We should remind the perpetrators of violence to freely join in the noble scheme of responsible fathers, responsible uncles and brothers, and together help teach and raise that boy child into someone who someday can be trusted with caring for somebody's daughter. I want to close with the following encouragement from two poems. One is an excerpt from Robert Longley, who redefines a mother and posits thus: it is not from whom we came from, it's who made us who we are. It's who gave us strength and courage. The second takeaway is adopted from a poem by Helen's Journey, simply called We Are Women. We are encouragement. We are strength. We are kindness. We are inclusive, captivating, patient and able. We are the wiping away of tears from our own unfulfilled yearnings of motherhood as we look after and parent the offspring of others. We are time givers, hug givers, love givers, care givers, advice givers. We are all those things and a whole lot more. We, the women. Finally, let us help turn the agony of the mothers in our society into a perfect fulfillment, in harmony with being more than a mother. Let us all work towards replacing a guile with a smile. We are women. Woman. I thank you.
Honorable Dr. Edwin Digoloti, Minister of Health, Honorable Naniki Velemina Makwinja, Assistant Minister of Education and Skills Development, Chairman of Merck Foundation Board of Trustees, Professor Frank Stangenberg Haverkamp, CEO of Merck Foundation, Senator Dr. Rasha Kelej, Dikhosi le bahumagadi ba ba leng hano, members of the Diplomatic Corps, heads of international organizations, heads and representatives of faith-based organizations, all permanent secretaries and deputies here present, all senior government officials, members of the media, bomme ba boteitiwa kavango kang moshopa le old naledi, bana ba rona, ke le dumedisa ka pula. It is an honor and privilege for me to join you this morning at the official launch of the Merck Foundation Partnership Programs that we started in 2018. when I was appointed as the ambassador of Merck Foundation more than a mother. I'm very delighted to host our long-term partners, Professor Frank and my dear sister, Senator Dr. Rasha, Chairman and CEO of Merck Foundation. And I welcome you and your esteemed team to my beautiful country, Botswana. Professor Frank, it was shared last evening that you have visited Botswana before as a tourist in the Okavango Delta. Well, for you, Rasha, this is your first visit, and I hope you can return and also experience the Okavango Delta. Today, we continue to celebrate an important milestone of the great success of our joint programs as we also share the impact of our partnership journey that we have with Merck Foundation. A partnership to build healthcare capacity, transform patient care, break infertility stigma, end gender-based violence, and support girl education in our country since 2018. All these contributing to the attainment of Sustainable Development Goals and our own Vision 2036, where in Botswana we aspire for prosperity for all. I'm happy that I've met and acknowledged the future healthcare experts of Botswana and the winners of Merck Foundation Media Awards. The Media Awards recipients are our health and social community champions in raising awareness about many critical health and social issues, such as breaking infertility stigma, supporting girl education, promoting healthy lifestyles, diabetes, and hypertension awareness, amongst others. I'm extremely proud of each one of you, the scholarships alumni, and the recipients of the awards. Keep up these fine achievements as you inspire other young Botswana. Distinguished guests, it was during the global pandemic of COVID-19 that we realized more than ever before the importance of advancing public healthcare sector, the public healthcare sector. We all are aware how our healthcare resources were stretched during the pandemic. I would like to take this opportunity to acknowledge the valuable partnership that we have with Merck Foundation to transform the patient care in our country by providing specialty training for our local doctors. As mentioned, we have made significant achievements within a short period of time since our partnership began in 2018. And as mentioned earlier, this was really thanks to cooperation from the First Lady, and I did not do it alone, by the way. I did it through the ministries. And let me take this opportunity to thank the Ministry of Health, Ministry of Education and Skills Development, and other relevant ministries for the support that you continue to give me in my advocacy endeavors. I would not have achieved so much. Today, similar to previous speakers, let me say I'm extremely proud about the 45 scholarships that have been extended to local Botswana doctors who will be the future healthcare experts of our country, ensuring we reach both SDG 3, good health and well-being, and as mentioned earlier, Vision 2036, where we are saying Botswana will live long and healthy lives. At this point, these doctors have either graduated or are currently undergoing training through Merck Foundation scholarships in those critical and underserved specialties, as mentioned before. I'd like to share details of the 45 scholarships for those of you who don't know, because one may wonder, where have we been? 10 scholarships have been provided for fertility and 1-year diploma and 2-year master degree of sexual and reproductive care. We are able to establish a strong platform of fertility and reproductive care experts nationwide. Considering the limited number of gynecologists in Botswana, this is a huge achievement, as it will help us to significantly improve women's health in general and reproductive care in particular, and of course contribute effectively to our objectives to empower infertile women and support infertile couples in their journey to build families. The Merck Foundation More Than a Mother campaign is a unique and historic campaign that aims to empower infertile and childless women through access to information, education, and change of mindset, while raising awareness about various social and health issues. Not only am I an appointed ambassador of the program, but it is personal, as I have close friends and relatives who are struggling to have a family. They have tried over the years and even exhausted family coffers, as the procedures are extremely costly. 4 scholarships have been provided to our doctors for a 1-year clinical oncology fellowship training at the premier institute in Africa. This is crucial as there are rising cases of cancer, not only in Botswana, but on the continent. To cite a number, we are aware that recent studies estimate that NCDs account for about 46% of all deaths in Botswana. 19 scholarships are being provided to our young doctors from different provinces for 1-year diploma and 2-year master degree of diabetes, endocrinology, and obesity and weight management under the Merck Foundation Nationwide Diabetes Blue Points program. After completion of this course, these doctors will be able to establish a diabetes or hypertension clinic in their health center or hospital with the aim to help prevent and manage these conditions in our communities. This will contribute towards improved access to quality and equitable diabetes and hypertension care nationwide. We all know that in our families, so common is hypertension that those who don't have it actually feel bad. It's that bad. 6 scholarships have been provided for acute medicine and respiratory care. This specialty is important as part of post-COVID care. Finally, 6 scholarships have been provided for 1-year postgraduate diploma and 2 years master degree in various critical and underserved specialties like dermatology, gastroenterology, and internal medicine. This valuable program has made a substantial contribution to enhancing access to equitable and quality healthcare solutions in many underserved specialties and is revolutionizing the patient care, especially in the public sector of Botswana. We've heard testimonies that confirm the gains as the alumni made their presentations. I'm proud of all of you, the Merck Foundation alumni from Botswana, and our hope as a nation is on you. You will ensure we reach the dream of a healthy nation as a productive nation leading to achieving development goals. I'd really like to thank you for insightful testimonies, and I'd like to just reiterate my own takeaways. It was most pleasing that you are clearly very dedicated to your communities. I'm very, very impressed because more often we have this general statement that gone are the days where we saw professional and caring professionals. Today, you have actually told us that it is not true. Thank you, Bonganaka. It is also very impressive that you see yourself sowing the seed. You are not only going to keep this to yourselves, but you are going to actually impart it and empower others. And then finally, I'm impressed at your appetite for self-development. A good number of you have actually shared that they are studying further or they are planning to study further. And there's one in particular who actually mentioned that they'll be doing project management. So you are even diversifying out of just medicine. According to UNFPA, over 2/3 of women in Botswana have experienced some form of gender-based violence in their lifetime, including partner and non-partner violence. Gender-based violence, as we know, has destroyed families and taken us back in the achievement of development goals and promoted disunity within communities. Therefore, addressing gender-based violence remains not only a priority in our country, but it remains my priority. It is something that I'll continue to pursue. During the COVID-19 pandemic, with heightened cases of domestic violence, a GBV campaign was undertaken. As part of the national GBV campaign geared at prevention, Merck Foundation donated 20 sewing machines. These machines were donated to women groups around the country to ensure they generate income for upliftment of their livelihoods. Bomma ke tla kopa gore le eme ka dinao ha ile gore le teng lona ba sehithwa Moshopa, Kang, Mathete, Shakawe, and Old Naledi. I'd just like to recognize you, ladies. Likanna hearts. Let me thank the respective districts, the district commissioners, for making it possible for you to come join us over these 2 days. As I mentioned yesterday during the cocktail, it is very important, particularly for Professor Frank and you, Rasha, and your team, as I said, to see these people. We have spoken about these beneficiaries during our luminaries, but now it's time to see them and actually talk to them. So I'm looking forward to Ituteng Primary School this afternoon, our interaction at Ituteng, and our interaction at Old Naledi, where you'll be able to ask more questions and appreciate why Botswana, or where the successes of Botswana resides. I shared with you a little bit about the Khotla system that makes it very unique, where the grassroots and leading from the bottom up is crucial in our society. In addition, the sewing machines were intended to promote skills acquisition, further empowering the women. We also launched a GBV poster contest in Botswana with the aim to stop gender-based violence. 13 finalists with the most inspiring posters were awarded prizes. Let me also take this opportunity to urge academia and research institutions to assist by producing accurate data that will enable not only government but advocacy groups launch appropriate interventions that will address infertility and other issues. So data, data, data. We conducted an online edition of Merck Foundation Health Media Training for the media fraternity in Botswana last year, and this important training will be offered in person this afternoon. Media practitioners will be trained on how to raise awareness about sensitive issues, including infertility stigma. And also to be able to report for increased health outcomes, including ethical reporting. Ladies and gentlemen, we are also working closely with Merck Foundation to launch Education Linda program to inspire girls and sensitize communities about the importance of girl education. This forms part of our strategic plan, and as I strongly believe that education is crucial in the development of any nation, particularly educating a girl child. And as they say, educate a girl, educate a whole community, or educate a boy or a man, and educate just an individual. During the course of the day, we will award scholarships. During the course of the day, we have awarded scholarships to 20 underprivileged but very, very brilliant girls. Moreover, Merck Foundation has donated 20 bicycles to ensure the girls have a form of transport that will enable them continue their education with least disruption due to transport issues. Let me at this point appreciate MVA and the Ministry of Transport, who will actually train these youngsters tomorrow. And Prof and Rasha, I'll actually have to take out my bike this evening in readiness for the training. Thank you, Merck Foundation, as you make these significant strides in supporting Botswana, which translates into an investment for the future. Ladies and gentlemen, we have also closely worked together to create a children's storybook, Not Who You Are, with the aim to stop gender-based violence, and many other storybooks that you saw here as we signed earlier, supporting girl education and in child marriage, diabetes, and hypertension awareness. Once again, on my behalf and on behalf of the people of Botswana, we welcome the long-term partnership with Merck Foundation to build healthcare capacity, media capacity, break infertility stigma, stop gender-based violence, and support girl education in our beautiful country, Botswana. These efforts will be the building blocks for both current and future generations. Let me also thank all stakeholders who helped me advance my advocacy course, Gorobokhosi, Ahumahadi, Lonabo Mme, and all other sectors who have held my hand. I would not have been able to be granted so many hats, including the hat that I got today. I thank you all for your attention. Apula Ina.
Your Excellency, the President of the Republic of Botswana, Dr. Mokgweetsi Masisi, Your Excellency, the First Lady of the Republic of Botswana, Jane Masisi, my colleagues, honorable ministers here present, Chairman of Merck Foundation Board of Trustees, Professor Dr. Frank Stangenberg Haverkamp, CEO of Merck Foundation, Senator Dr. Rasha Kelej, PSP, PS Minister of Health, Professor Watlogwanko Mazana, senior government officials here present, senior officials from the private sector and NGOs here present, members of the media, distinguished guests, ladies and gentlemen, a very good morning to you all. Director of Ceremonies, I am immensely delighted to be part of this historic event, the launch of the Merck Foundation programs in partnership with the First Lady of the Republic of Botswana. I'm also happy to acknowledge the presence of His Excellency, the President of this beautiful Republic, Dr. Mokgweetsi Masisi. Your dedication, Your Excellency, to serving this nation remains second to none. Distinguished guests, ladies and gentlemen, we are gathered here today not merely to celebrate a truly big-hearted initiative, but also to mark a profound commitment to nurturing the future of healthcare across our nation, Botswana, through benevolence and foresight of the Merck Foundation's health scholarship initiatives. In Botswana, where we face a range of health challenges, from chronic diseases to maternal and child health issues, the need for well-trained medical professionals has never been more critical. The Merck Foundation has recognized this need and has taken a commendable step by offering scholarships that empower our health professionals with specialized knowledge and skills. Distinguished guests, ladies and gentlemen, the Merck Foundation, together with the First Lady of the Republic of Botswana, Marona, now Jane Masisi, have transformed the patient care landscape of the nation by providing 46 scholarships in many underserved and critical medical specialties such as diabetes, endocrinology, embryology, fertility, oncology, and respiratory care, just to mention a few. As I conclude, Director of Ceremonies, I am delighted to state that the Merck Foundation Health and Education Scholarships represent a vital investment in our medical professionals and young scholars. Let us, therefore, celebrate this initiative and continue to support our doctors in this pursuit of excellence. Together, we can build a healthier future for Botswana, one where every citizen has access to quality health care they deserve, as envisioned in His Excellency, the President of the Republic of Botswana's reset agenda and our nation's vision of 2036. Ladies and gentlemen, you are welcome to our beautiful country. We are truly honored by your presence. I thank you all for your kind attention. Nelwang Kipula.
Foundation leadership, all dignitaries, protocol observed. Good morning. My name is Dr. Bobiko Simang. I am a family physician. I completed my diploma and MSc in diabetes management through the University of South Wales, thanks to Merck Foundation scholarship. Since completing these courses, amongst other things, I have been able to share knowledge and transfer skills to doctors and other healthcare professionals in my district through in-service lectures and workshops. I've also had the opportunity to be invited as a speaker for the last year's Merck Foundation Health Media training. I have gained in-depth knowledge from my studies. I feel confident in what I do, be it training colleagues or consulting patients. I'm able to consult complex cases. With the knowledge I gained through my studies, I have reduced the need to refer patients to referral hospital, as I can manage most of these cases in my district, therefore reducing cost burden on the government. The community is greatly benefiting from my training as I give them quality medical care. This means fewer diabetes complications and halting progression of the complications. From my training, I continue to advocate for my patients to get modern diabetes medications. All this leads to improved health outcomes and satisfied customers. Lastly, I would like to thank Merck Foundation for the scholarship. This educational opportunity would not have been possible without your generosity. Thank you.
It is such an honor to stand before you today as an alumni of Merck Foundation. This organization has been instrumental in my educational journey and my professional development. In 2021, I had the opportunity to enroll in a postgraduate diploma in sexual and reproductive medicine at the University of South Wales. This course equipped me with essential knowledge and skills, which significantly enhanced my ability to perform my job. At the time, I was working in a semi-rural area where there were limited resources for consultation. The diploma laid a crucial foundation in matters of sexual and fertility medicine, allowing me to provide better care and support to my community. Having been successful in my pursuit for the diploma, I felt encouraged to further my studies. With the continued support of Merck Foundation, I applied for a Master of Science in Sexual and Reproductive Medicine at the same university. I was fortunate to be granted this opportunity and successfully completed the program in January 2023. This advanced training not only deepened my expertise, but also improved my day-to-day consultation and overall professional confidence. Apart from the acquired knowledge, the Merck Foundation has significantly boosted my confidence to pursue a field of great importance to me. I am currently studying for a Master's in Medicine, Obstetrics and Gynecology at the University of Botswana. The high-level education and training I have received has prepared me very well for this current endeavor, and I'm immensely grateful to Merck Foundation for that unwavering support. Thank you to Merck Foundation for believing in me, and all of you for being part of this incredible community. Together, we can continue to advance the field of sexual and reproductive health and make a positive impact on the world. Thank you.
Her Excellency, the First Lady of the Republic of Botswana, Merck Foundation leadership, all dignitaries in the house today, I greet you all. My name is Dr. Lorato Sopani, and I'm a Merck Foundation alumni, class of August 2022. I enrolled in postgraduate diploma in endocrinology, and I remain deeply grateful to Merck Foundation and the Ministry of Health for the opportunity. The content of severe shortage of endocrinologists in both the private and the government sector in the country cannot be understated. And for a general practitioner like me in a district hospital to have gained insight information in endocrinology has served a great impact in my community. So there was, because of currently there are 3 endocrinologists in the government sector and 5 endocrinologists in the private sector. So thanks to Merck Foundation, I'm amongst the 3 in the government sector. And this goes without saying that the burden has been so much in the specialist for the referral of the patients, and also the implication of mismanaging and misdiagnosing the patient. So upon completion of my study, I was more competent in managing endocrine conditions, and also through in-service training, I was able to share the knowledge with my colleagues. And through that, there was a great reduction in the referral to specialists, and also an improved care in the patient health system overall. So during my journey with Merck Foundation, I found a gap in research, and that has encouraged me to enroll in public health medicine with the University of Botswana, the course that I'm currently pursuing, to try and close the gap in research. So in conclusion, I wish Merck Foundation to continue with the scholarship with the oncoming students, so to continue as an attempt to amend the critical strategy of specialists in the country. Thank you so much.
Her Excellency, Madam First Lady, Merck leadership, all dignitaries, protocol observed. Ladies and gentlemen, a warm welcome and good morning to you all. I am Honest Steven, a medical lab scientist, also a clinical embryologist, currently employed by the Ministry of Health. As one of the beneficiaries, I am grateful for the opportunity I was offered to study biotechnology of human-assisted reproduction and embryology at Manipal Academy of Higher Education in India, which is a new profession in the country. And as a passionate clinical embryologist, I must say I am well equipped in the field of reproductive medicine, and I'm ready to utilize my skills. It is imperative to note that these technologies are scarce, especially in low and middle income countries. Ladies and gentlemen, efforts are underway for collaboration opportunities to establish a local in vitro fertilization, that is IVF center for treatment of infertility, as data have indicated the need for these services. And through conversing with some affected people, I noticed infertility has negative social impacts in their lives, especially women who frequently experience social stigma, shaming, violence, and divorce, resulting in negative emotions such as depression, anxiety, and low self-esteem, since motherhood is considered a rite of passage for women. But this is due to lack of knowledge, failure to understand that infertility is a medical condition affecting both males and females equally. Therefore, establishment of a local center will not only reduce stress, but will also alleviate the cost associated with seeking IVF treatment services outside the country. And for a seamless establishment of this center, input is also required from relevant key players. Together, we can help to change the narrative, as infertility is not a cosmetic service, as commonly classified. Merck, I will forever be grateful. Thank you.
Your Excellency, the First Lady of the Republic of Botswana, Merck leadership, dignitaries here present, let me stand on the established protocol. Good morning. My name is Dr. Tirimalo Okami. I'm a specialist family physician, and let me say that I am very, very proud to stand here before you today because of the passion that I've had for respiratory medicine. I think we all come from a background of COVID, and even prior to that, I had really looked forward to studying chest medicine. The sponsorship that I received from the Merck Foundation set a tone for me, where currently I have now leading a clinical team in the district in Tlokwe. And through that team, we have been able to strengthen the prevention, the treatment, and the diagnostics of respiratory conditions. And through that team, we have been able to now try and actually strengthen and build capacity just outside that one district, but also to extend it into other districts. We have also forged relationships and stakeholders meeting with some of our partners, both in private and public. One of our key engagement was with Princess Marina, And we have now even gone beyond what we started off with, and we are now offering capacity just beyond respiratory medicine. We are now even doing ear, nose, and throat services within the district. One of the remarkable outcomes that we have so far received was the positive feedback from the community members who used to seek those services outside the district. And as a clinician, I can tell you it is far more rewarding when your patient in front of you is very happy and acknowledges the efforts that you have put in order to try and reduce the cost of seeking health services. Unfortunately, on the goals that we have set, for me personally and for my team, we are not yet where we want to be. And hopefully through our advocacy and through Merck Foundation sponsorship, through the Ministry of Health support, we should be able to establish a robust and resilient respiratory medicine program within Botswana to ensure that we are resilient if we are to face another pandemic like COVID. I'm sure today all of us here are well aware of my PS's primary healthcare revitalization strategy, and I hope that through that strategy, we should be able to ensure that respiratory medicine is one of the covered areas and it is not left behind. Ladies and gentlemen, I'm very grateful for the opportunity that I've been given, and let me once again thank Merck Foundation for the opportunity that they have given me, and let me also encourage them to continue in the advocacy for healthcare and capacity building. It is a journey that I'm very proud to be part of. Thank you.
Your Excellency, the First Lady, Merck Foundation leadership, all dignitaries, protocol observed, good morning. As already introduced, my name is Patricia Rantabeng. Professionally, I'm a scientist in the Department of Pathology, University of Botswana. I was awarded a Research in Oncology Fellowship under the Merck Foundation Cancer Access Program, totaling 6 months of study at the Tata Memorial Hospital in 2017 in Mumbai, India. My training was mainly focused on acquiring skills in molecular pathology, whose application to cancer research was still at infancy in our institution then. I've since graduated with a Master of Philosophy in Medical Sciences degree, and as of March 2024, I'm a Certified Associate in Project Management. I have been promoted and currently overseeing academic research activities in my department, in addition to supervising post and undergraduate student research, mentoring junior researchers as endorsed by the Dean of the School of Graduate Studies. The highlight of my research journey since the fellowship is leading a cervical cancer screening project targeting 171 women from the indigenous and marginalized communities of Kgalagadi and Kgante districts in Botswana. The aim of this project was to determine cervical disease burden, associated risk factors, and barriers to participating in health screening exercises. Our project was successful, reaching 258 women, whom we also educated on the benefits of participating in health screening exercises and following up with their results to enable timely commencement of treatment of those in need. In conclusion, I would like to express my gratitude to Merck Foundation for acting as a springboard to my career development and for positively impacting the communities we serve. Thank you.
Greetings, ladies and gentlemen. Protocol is highly observed. Standing before you is Pamela Aunemanui from Luhutelo JSS. Today, I and my colleagues are here to present about type 2 diabetes and how it affects children. Effects of high blood sugar in the body. Thank you.
Eye damage, heart disease or stroke, high blood pressure, kidney disease.
How to manage type 2 diabetes. Adhere treatment. Exercise often. Eat a well-balanced diet. A strong support system helps to cope with diabetes.
How to prevent type 2 diabetes. Engage in fun-filled physical activities. Avoid sugary foods and drinks. And keep a healthy weight. Thank you.
Let me stand on the established protocol, but it will be remiss of me not to appreciate and recognize our First Lady of the Republic of Botswana, Neo Jane Masisi. Let me also appreciate those that have made sure that this day is such a success, mainly our MCs. Repenyo, you never disappoint. This has been facilitated so nicely that I wondered where you have been all this time. So thank you very much. And of course, Teboho, your co-host, you did exceptionally well. We often do not recognize you, but I think today you are worth it. Let me appreciate, ladies and gentlemen, and recognize Dr. Dikolodi, who gave the opening remarks this morning. And I am sure your opening remarks were well placed to actually start the day for us. Let me recognize Professor Haverkamp and Senator Dr. Rasha Kelej, both from Merck Foundation. Professor Haverkamp being the chairman of Merck Foundation Board of Trustees and former chairman of Executive Board of Merck KGaA. Dr. Kelej is the CEO of Merck Foundation, president of More Than a Mother campaign. Ma'am, the little interaction that I had with you was so illuminating that you have given us the energy to actually support Ma'am Mazile in this great work that she's doing for our country. And we thank you for that. I would like to thank Merck Foundation for its generosity and mainly for its foresight, for bringing First Ladies of Africa together, for supporting them so that Africa can be a better place for all of us. And for that, we thank you. Ladies and gentlemen, I have not prepared a speech, but to say a few words as a vote of thanks. I would like to thank the technocrats that have made this day possible. It's not easy to organize such an event. And I recognize in her absentia, PSP, and her team of technocrats, PSs, deputy PSs, and their officers who have made this event possible today. And for the media, if it wasn't because of you, we would not be known for what we are in this country, led by our Excellency, Dr. Mokgweetsi Masisi, who I believe, if it wasn't because of him, we would not be having our First Lady and Merck Foundation here. So we must actually thank him profusely for leading us and making us so proud of our women in this country, making us so proud of our education and our health system, which we can see that with the help of Merck Foundation, we are going somewhere. So ladies and gentlemen, I would like just to take a few minutes to say that I really feel greatly honored to be here to give this vote of thanks. Let me start by thanking in no small measure our First Lady of the Republic of Botswana, Mrs. Neo Jane Masisi, the ambassador of Merck Foundation More Than a Mother campaign. As mothers, as women, together with Botswana, we highly appreciate and applaud you, Madam. In the education sector and the health sector, we need not say more. You have seen today the value of having Mayor Neo Jane Masisi as our First Lady. And I think I'll put her side by side with His Excellency for the great works that they are doing for this country. We are really proud of you. We really, I don't know how to describe it, but I think you get it. I think the team here gets it, because without these interventions, without your foresight, your passion for the institution of the family, marriage, children's well-being, cannot be overemphasized. And you are taking us where we should be proud of, where you are going to leave a legacy that will live on long, long before, after you vacate your office. So, Matsile, we are here to say thank you so much for actually awakening the spirit of Boto, the spirit of self-respect, the spirit of being a Motswana. We really thank you, because all these interventions are aimed at getting us there. And we thank you so much for that. We appreciate and applaud you, Mematsile. I can say a lot about the initiatives that we have started and are still going on. Stop GBV, as we have seen, the drugs, we have been with you there. Teenage pregnancy, Isimongwaneng. All these are initiatives to build a better Motswana, a better Botswana. And for that, we have to, as a nation, as an education, in the education space, in our homes, try to live up to some of the objectives of these initiatives, because they can bring us back to who Motswana used to be, a very respected, dignified, and pragmatic person. Maruna, we are blessed to have you at the helm of the Merck Foundation initiative, More Than a Mother campaign. We thank you profusely, Maruna, for bringing Merck Foundation into this country, because as a First Lady, you are among those that have really championed the work of Merck Foundation, such that we are changing lives. And we have seen that today. We have heard the testimonials from the alumni. You have seen the donations. You have heard about the scholarships. All these are happening. They are not about to. They are happening and have happened, and they are changing lives. And for that, I would like to thank you Mematsile. I would like to thank Prof here, Professor Haverkamp, and Dr. KGaA for your support for our First Lady. Becho, I think I have done my thanks, and I would like to acknowledge and thank the alumni and those that are receiving donations or have received donations for exemplary work that you have done. The sewing machines, I think you are earning a living out of that. Your livelihoods have actually improved. As for the doctors, I really don't know what to say. You are going to be we are having a great impact in terms of our healthcare system. And for that, for the love and the passion that I saw when you were talking to us, I believe that we should all thank you for your dedication and passion for your profession. Ladies and gentlemen, let me thank all those who have made this possible. And let me thank the esteemed guests that have been invited here to support Mematsile in terms of what she is doing for us. And I thank you so much.